Hi, this is Dr. Bob Dannenhoffer. I'm the Public Health Officer for Douglas County and a pediatrician here in Roseburg for many years. Today we're here talking about measles. Measles has been very much in the news. 2025 was our worst year for measles since 1992. Over 2,000 people in the U.S. were diagnosed with measles. We had 3 deaths and hundreds of hospitalizations. So measles is really in the news, and especially it's going to be in the news in Oregon this week because we had our first cases in over a year from Linn County, which is up in the Albany, Lebanon area. We don't know much more about those cases, but we do know that these people were in the emergency room and presumably exposed others during that time. Measles is a terrible disease. I'm old enough to remember having had measles and remember a time when I first started practice when measles was still circulating. It is a terrible disease. I tell young doctors who haven't seen measles that the least sick kid with measles is still sicker than anybody else you've seen this week. And thus we developed immunizations for measles starting in the 60s. They became widespread in the 70s, and by the 80s, measles was pretty much gone. So anybody who's younger than 50 or so doesn't ever remember measles and measles circulating. There's been some myth that, we grew up in the 80s with measles and it wasn't such a severe disease. That is not true. Most people who are 50 and under have never had the measles and really don't remember anybody having measles. They frequently confuse it with something like chickenpox. Measles is a bad disease. It starts out with a high fever without really a lot of other symptoms. So the people who get this get really high fevers, 104, 105, 106. They may have a little bit of cough, a little bit of runny nose, a little bit of red eyes, but really nothing specifically to suggest measles until a few days into it when they develop a rash, which starts at the top and moves down. The rash itself is not itchy, but it's pretty awful looking. And by this time, unfortunately, you've been contagious for a few days. Because measles is so contagious, we would want to be sure that if you think you or your child has measles, that you call the provider before you show up. Worst thing to do would be to show up and be in the emergency room and expose everybody else there who was susceptible. And those people are susceptible, maybe babies less than 1 who can't get the vaccine, or people with transplants who can't get the vaccine. There is no specific treatment for measles. Antibiotics don't work, antiviral drugs don't work, steroids don't work. You get the measles, you just need to have supportive care, fluids sometimes, to help you through it. After measles, a lot of kids will develop ear infections or pneumonia, and those can be treated with antibiotics or antivirals. Far and away, the most effective prevention is vaccine. Vaccine is 97% protective when you have 2 doses. And in fact, when I looked at the recent outbreak in South Carolina, about 300 cases, almost all of the cases were not vaccinated. Only 2 were fully vaccinated. So vaccine really does provide tremendous protection against this. This vaccine is widely available. Previous concerns about relation to autism have been thoroughly debunked. And thus we would recommend everybody who's not been up to date on their measles vaccine go ahead and gets it. Again, if you think you or your child may have measles, please call the provider before you show up so that you don't expose others. For more information about measles, please check the information below. Again, this is Dr. Bob Dannenhoffer, pediatrician and public health officer for Douglas County.